Hi Robyn, here we are at ASH. I know a lot of people wanted to take a look at who you are because they've heard about you because of the Fatigue Project. And maybe let's start by talking a little bit about you, how you got into hematology and into the MPNs, and then move it right on to the Fatigue Project itself.
Sure. So my name is Dr. Robyn Emanuel. I'm from Mayo Clinic in Arizona. Along with Dr. Ruben Mesa, I'm one of the members of the MPN team down there. I first got into myeloproliferative neoplasms when I began to work with Dr. Mesa, and I had a lot of people that I knew affected by hematologic malignancies, but the myeloproliferative neoplasms are a significant portion or a significant group of those patients. This includes myelofibrosis, polycythemia vera, essential thrombocythemia. Where the Fatigue Project comes from is actually, it's stemming from earlier work looking at myeloproliferative neoplasm symptom burden, as well as specifically fatigue. We know that among MPN patients, fatigue is the most prevalent symptom and one of the most severe symptoms. We know that it, compared to age-matched controls and other cancer-matched controls, it significantly impairs quality of life. This project has had almost two phases. Our first phase has been complete, and that was some of the data that we presented here at ASH, which actually looked at fatigue in a little bit more depth. We know that there were a couple of great things that came out of the data, including the idea that like what strategies patients are using to actually help alleviate fatigue, as well as strategies from the pharmacological aspect of what actual agents these patients are using. Phase 2 of this project is a more robust survey where we actually look at demographic variables, psychosocial variables, as well as even different therapies that patients are using on their own accord to try to alleviate fatigue and see what's most efficacious. At that point, we hope to actually bring this into even more clinical trials and more phase 3 projects to try to see if we can actually incorporate this into home interventions as well as pair it with medical interventions in some of our upcoming clinical trials, and ultimately get this information back to the patients in the form of a patient-centered curriculum.
Any idea about timelines?
We hope to have this survey out in January, this phase 2 survey that looks at MPN symptoms in a little bit more robust fashion, specifically MPN fatigue. And at that point, we hope to have the data out by June of this year.
So do you think that by the middle of next year, we'll be some of us will be able to employ some of these techniques in relieving fatigue?
Definitely.
So we just have to suffer for another 6 months? Is that what you're saying?
Hopefully. Well, the reality is, patients, especially MPN patients overall, are you guys have been amazing in actually being able to try to find strategies for yourself. So what we're actually doing is hoping to glean from your knowledge. So I say whatever you're doing, do it to the best of your ability, and we're going to be trying to learn from you. And our hope is that we can take what you learn and disseminate it to other patients.
That's great. Thanks very much, Robyn. I appreciate it.